Hello, thank you for joining us today. The topic of discussion will be assurance that the policies implemented regarding HIV in African children are efficient. The authors of this presentation are Jasmine Davis, Wendy Deal, Donna Devenuto, Kelly DeVore, and Christina Gebhardt. This presentation will cover the following topics. How will we assure the public? What laws and regulations will we implement to keep the public safe? And how will the public know what programs and resources are available? Because HIV affects so many people, there needs to be a lot of cooperation between those infected and their families. Assuring the public is not always an easy task. We have to make sure that the public knows that we are on their side and that we are trying to help the children in Africa that have been exposed to the HIV virus. If we start early in their lives, we can make a huge difference. We have to talk to the parents of these children because a lot of the children in Africa were infected through fetal transmission. This makes it all the more important for the families to become involved in the prevention of HIV. According to UNICEF, early childhood development includes all interventions directed at children or their caregivers. This means that we have to work with both the children and their parents as well as the healthcare providers to ensure the safety of these children. For laws and regulations, we can refer back to our earlier PowerPoint presentation. There are two ways to approach the HIV virus. The first is to treat it through prophylaxis, and the second is to treat the host after the virus has infected them. The prophylaxis treatment includes parent and family-based interventions that include groups like CHAMP SA and Let's Talk. These two programs train parents in Africa how to talk to their children about HIV. Also, preventing mother-to-child HIV transmission with the use of medications is included in the prophylaxis treatment. Treating children after an infection is just as important. There is no cure for HIV, however, there are treatments available. Antiretroviral treatment medications are given to patients to keep the virus controlled. These medications are taken as a sort of cocktail that includes 3 drugs out of the 5 classes that were discussed earlier. Using these programs and treatments will ensure that all children in Africa are getting the help that they need. There are many ways that the public can find out what is going on in the treatment and prevention of HIV. The Center for Disease Control, the International AIDS Society, the National Institute of Health, the Institute of Medicine, UNAIDS, and the World Health Organization are just a few of the organizations that people can turn to for information. These organizations have put in many dedicated hours to researching HIV, implementing policies regarding treatment and prevention of HIV, and keeping the public aware of their progress. The policies and procedures that have been put into place are effective for the treatment and prevention of HIV. As long as children are receiving the care that is outlined, they have been improving. There are easy-to-access websites, numerous papers that have been published regarding studies, and thousands of children in Africa are receiving treatment or prevention therapy. In conclusion, HIV is a virus that affects thousands of children in Africa. 71% of the world's population infected by HIV live in Africa. They are in great need of help. All of the organizations associated with HIV have been working together to ensure that the children of Africa do not suffer as they have in the past. Policies and procedures have been put into place that will help the children and their families to prevent the spread of the virus. Thank you for your attention. If you have any questions, please feel free to ask.